welcome back to my channel, or welcome to my channel if you are new. My name is Bailey. I'm with my puppy, my little sleepy baby right here, and my little kitty is right here. And it is just a peaceful, lazy, chill Sunday today. I am going to start studying, spend the rest of this Sunday getting everything together for nursing school for the next week. But first, I thought that I would come on here and film a little like what's in my skills bag that they sent home with us for online nursing this semester. So basically, since we were online and they didn't know if they were going to be getting us into the skills lab for any part of this semester to test off and like practice our skills, they decided to send us home with a bag of nursing supplies and skills supplies that we would be going over this semester. Don't really know what they were expecting us to be able to do with the supplies, because honestly all we can do is look at it. We can just look at it. We don't have anything to practice on. So like starting an IV, like we have all the IV supplies, but we don't have an arm to start an IV on, you know? We don't have the practice arm or any of that like practice fake skin or anything. So I mean, nice effort, guys, but I have not really done anything with this the entire semester, and we have like 30 days left of the semesters. Another reason why I wanted to film this video is because we actually just had our last skills class for the semester, so we won't be going into campus to test off on skills anymore, which is bittersweet because this semester really wasn't the type of skills experience that I was wanting. Only being able to go in for about an hour, barely getting any any practice before testing off, which is not how it was last semester at all. We were in lab for 3 hours, learning and practicing and doing all the hands-on stuff. So it's definitely bittersweet because it's nice to know that I've learned all the skills that I need to be a nurse now, because for the next 2 semesters, 3rd and 4th semester, we don't have skills anymore. We're just going into specialties next semester, and then it's preceptorship. Like, now we've learned all the skills we need to be a nurse, which is crazy and exciting. But at the same time, I'm like, did I really learn it? Like, I don't really know. I know the steps to starting an IV, but I only started an IV once on my dad. And he's a paramedic, so he helped me. And then once on a fake arm to test off on in skills. So like once I go into the clinical setting, I'm not gonna know how to start an IV, especially on patients like the elderly or someone who's severely dehydrated. Like that is a hard IV to start, and I have no practice with even like with anything. So that's where it's bittersweet. I would love to go to skills again next semester once we can like be more in person and learn all of this stuff again, but that's not gonna happen. So it's crazy to think that I already know all the skills that I need to know as a nurse. It's kind of wild to think that I still have 2 semesters left of nursing school and we don't have any more skills to do. But that's another reason I thought I would come on here and show you guys what is in my skills bag, because I won't be needing it anymore. I mean, it's always good to practice with, but I have nothing to practice on, so fun. Okay, so let's get into it. Let's see what we got in here. So this is a huge bag of IV supplies and stuff. Let's just empty that out. They just gave us like these little tiny cute little mini saline bags. Really adorable, literally the size of my hand. Only 50 milliliters in that, but just a little practice one, of course. Can't use it because we have nothing to start an IV on, but I guess if you want to like practice like spiking a bag and stuff, you can practice on this. Just a bunch of normal saline syringes for like flushing and stuff. Pretty sure that's a used needle from the time that my dad was showing me like the different kinds of needles and stuff, and so that's what happens when you use an IV needle. it gets locked in there and now it can't come back out, like at all. That's pretty cool. If you guys were interested, you know. Got my tourniquet. Let's see, this is just like the dressing that goes over the IV when you put it in to hold it in place. What is this? Oh, this is a filter needle. This is for if you have an medication in an ampule, which is something that is like this glass vial thing. I'll insert a picture if I can figure out how to do that. I don't have an ampule here, but it's medication in a glass vial that needs to be broke to be able to get the medication out. And since you're breaking glass, there's a chance for little glass particles to get in the medication. And if you don't use a filter needle to get the medication out of that vial, then you could potentially be literally injecting glass into your patient's veins. So very important to remember when you're getting medication out of an ampule to use a filter needle. This just looks like this. This is an 18 gauge needle. Just looks like this. Actually, I can open it up. I can open this up. Okay, so this is interesting. See, I don't even really know what I'm looking at either because I have no experience with this stuff. Yet supposedly I'm supposed to know exactly what I'm doing when I go into the clinical setting. Okay, I don't really know how to get that needle out of there. It's some sort of safety mechanism that's not doing anything for us. Hypodermic safety needle. Well, nice. How do you get the safety needle out of, how do you get the needle out of the safety? I don't know. Just like a regular disposable chuck pad, catch any blood or fluid or whatever's coming out. Just some gauze sponges. This is just like a label, what you would, oh my god. So this is what you would put on the IV site where you have your IV. So you would put the date and time that you put it in, the gauge, and what does that say on the bottom? Oh, the initials of the nurse that put it in. Just some fun medical stuff, you know? We got some practice furosemide. They just call it a medication, but it's literally just saline water. So like I have an insulin syringe here, which they didn't actually even give us. So they gave us stuff to like practice administering medications, but they didn't even give us a needle to like get the medication out of the jar. I literally had to get this from work. So if you have your insulin syringe or whatever, you take it off. There's the needle. It's all messed up because it's like literally bent because I've been practicing with it for so long, the same needle. But basically, to get medication out of a vial, you want to, if it's a multi-use, you need to make sure that you're putting the same amount of air in as what you're taking out so that it doesn't explode or anything. So let's say I want like 20 units. This is not measured in units, furosemide isn't, but insulin is. And then you're just gonna see if we can do this. The needle's so bendy. And you're gonna insert the air, you're gonna flip it over, and then that's when you take out your 20, and then take it off. Then you can cap it and go to your patient and then give the injection. This is what I use to practice my injections on. Literally just a random little sponge. Oh, I just sent some medication flying. And then I would literally like, say you're gonna dart, or you're gonna pin it, and you're gonna dart. And you go like that. Ta-da! And that is how I was practicing my injections on a patient. Fun times, right? Online nursing school is fun. This is not extender tubing, piggyback tubing. So if you have what are you trying to do, huh? You want to see what's over here? So if you have a bag of like normal saline running and you have to like piggyback a medication onto it, this would attach to the medication bag, and then this would attach to a port above the pump, and then you always want to hang the normal saline bag below because it's going to pull from gravity, so you want the bag that it's pulling from to be the medication first, or else it's going to run all of the huge 1,000 milliliter bag of saline before it does any of the medication, and you don't want that. So that's that. Yeah, and it comes with a hanger. I don't know where the hanger is though. I think I left it at my parents' house, but it looks like this. A little hanger to put the bag of fluids, whatever fluids are being administered, to hang it below the medication that you want administered first. So that's fun. A little bit of nursing knowledge with Bailey. This is an NG tube. My video for me going into skills to practice NG tubes is already up on my channel if you want to go watch that. And that just goes to show you how much this bag is not being used. This is our only NG tube we were sent with, and I haven't even opened it, and we already checked off on NG tubes. So, but basically it comes in this sterile thing, so you want to make sure that what is going to go like down into the patient like stays as sterile as possible, obviously. So this is your NG tube. It's used for suctioning out gastric fluids, blood. If you have surgery in the gastric region. It can also be used for feedings if needed. It just goes in the nose and then down and all the way down and sits in the stomach. For this to start, you want to measure from here, from here to the ear, and then you want to go down to the xiphoid process, which is like right here. So then you take it and be like, where is that? Then 57. So that is about approximately where it's gonna go, but then usually you add 10, this is in centimeters. Yeah, you add 10 centimeters to that, so 57, 67. So I would be going down to 67. Oh, that's a lot. That was pretty deep in there, but that's how you do it. And then you just kind of go like this, and then you have them when they're right here. You have them put their chin like this, and they have to drink water because it helps it go down. And then it just all the way down until you get to where it's supposed to be. And then you tape it and all that fun stuff, and then you have to verify placement with an x-ray. I feel like I'm missing a lot of how this procedure goes. It just goes to show you what we're learning. Not a lot. Like if I were to have done this in skills, spent the amount of time we would have spent on it in skills, also learning about it in lecture at the same time, and then going into clinical and seeing it and doing it in clinical on real patients, like that is how you learn. That is how you dig this stuff into your brain and it doesn't leave. And that's not happening this semester, so my memory is a bit shoddy, a bit hey, no, what are you doing? So there's that. They gave us some sterile gloves. Not too sterile anymore, these gloves. We got a suction catheter kit. So this is for trachs. So suctioning a trach and then in turn suctioning the mouth. Anytime they come like this, it means it's a sterile procedure. It's gonna come like this, and everything on the outside isn't sterile, and then everything on the inside is gonna be sterile. So like you would open it like this and like this, and then everything in here is sterile. Obviously this isn't real, so I'm not gonna keep it sterile, but in real life that's how you would do it. And they give you a pair of sterile gloves to put on. And this is the suction catheter. This has to stay sterile, everything that goes. So you always have one hand when you're suctioning a trach, one hand that doesn't stay sterile, that manipulates the suction thing. So you like stop and go and stop and go and stop. Or yeah, no suctioning, and then it'll suction. No, section, no, section. And then your dominant hand is the one that stays sterile, and because all of that's going into the body needs to be staying sterile. So you put it in, and then you kind of pill roll it back and forth like this. You take it out, and you only keep it in there for 10 seconds because it's like they can't breathe. And you also want to do the mouth. And then just like a trach care kit. And this just comes like this, and it's a bunch of different like places where you put saline to like wash everything. It's like a bunch of different things to clean a trach with. Literally looks like you're going to clean like a sink or something, or a straw. But yeah, a bunch of stuff to clean the trach with, and then you have the thing that goes around it to keep the skin protected and everything. And then it also comes with a new trach collar, which my instructor said that most facilities, they carry a way more comfortable trach collar in a separate package, and that you shouldn't be using these anymore because these are pretty rough. Like they're just like, it's just like a shoelace. So like, think about it, it's very rough, rubbing on the neck all the time. So there's better ones you should use and not use that one. When you're doing that, if you're ever doing trach care, if anyone is interested in knowing this, probably not, but I'll do it anyways. Let's see, this is a dressing change tray. So this is for wound care, and it just looks like this. So you have a bottle of saline, just a bunch of stuff to clean the wound and repack it, a pair of sterile gloves, because obviously you want to keep the wound clean and free of infection and contaminants and anything like that. There's scissors. And then just, it comes with things to measure. My cat is trying to chew on all of the stuff that's out right now. Measure, so when you're charting what the wound looks like, you can get all the measurements. Hey, stop it. So yeah, there's all of that. And she just jumps right back down and is back in the same place she was before. Great. I'll try to get through this a little bit faster. Irrigation tray. This is also pretty sure for wound care. Whoa. Oops. Actually, I mean, an irrigation tray can be used for a lot of different things. You can irrigate a NG tube. You can irrigate a wound. You can irrigate a PEG tube, a JPEG, a G tube, any of those tubes. Hey, stop! Karma. Let go. Oh my god. She's literally going crazy over here. So yeah, I think stop. Tell the camera what you're doing. Tell the camera you're being crazy. Next, last but not least, is a Foley catheter kit. Another thing that is a very important skill for a nurse to know is putting in a Foley, and we have the kit but no way to practice it. And luckily, as a CNA, I've had a lot of experience with caring for Foleys and assisting nurses put in Foleys. So I do know a good bit about Foleys, and I have also helped straight cath patients before. So it's not horrible, but I mean, it's always nice to have some practice. Like, of course I've seen it being done and I've cared for it and I've been around it, but I've not done it myself, you know, a lot of times. So, I mean, it is what it is. But this is another sterile procedure. Obviously, you don't want any bacteria or anything that could potentially infect the urinary system going in, because you're introducing a foreign object up in there. And catheter related UTIs are a huge issue when it comes to Foley catheters, and so that's a big reason why they want to leave a Foley in for as little time as possible. And the Foley care is very, very, very important to keep it clean and everything. But this Foley kit just looks like this, and it comes with some sterile gloves, some drapes and everything, just some cleanser, normal saline to inject the balloon, and some lube for the tip. That sounded funny. I'm not meaning to say it like that, but that is literally exactly what it's for. So this is the foley bag. We get a whole ass foley. And this is all sterile, so it all comes in here. Take it out, lube up the tip, and there's my saline. So the saline goes in here, and then once you have it inserted into the bladder, and usually you can see urine start to come out, so then you want to inject the saline into the foley, and you'll see it'll start to inflate a balloon. That is how the foley stays in place in the bladder. You can see it's starting to fill up. Pretty darn cool. There it is, it's all in there. It's a very, very tight balloon, and literally as soon as I let go of this, it'll all go, it starts going back into the syringe. I wonder if it's supposed to do that. Let's see, if I take it out now, will it all come squirting out? No. Okay, there we go. Then now you have a foley in there, and then you just tug a little bit, see if it comes out, and if it doesn't, then you know you're in the right spot. And then to take it out, you would just obviously collect the saline from the bubble and then pull it out of the urethra. And yeah, that's a foley. For everyone who is interested, I bet you guys really, really enjoyed that demonstration. But yeah, now I have a huge mess of nursing supplies surrounding me, and it's actually, I feel like, pretty good motivation to now go and study. So, I mean, it's almost the end of the semester, so I need to get my stuff together and pass second semester. So that is what I'm going to do. I'm going to study, and I'll bring you guys along with me. Okay, well, thanks for watching. I hope this was like somewhat interesting, at least for you guys. I know that I like to watch stuff like this on YouTube, so I hope I'm not alone in that. And I hope at least some people find this interesting or useful or helpful. I don't know. Sorry, Karma's messing with the plastic over here. Let's see. This is the mess I got going on, and Karma doesn't want to. Okay, you're just gonna. Oh my goodness. I can't believe I just got that on video. Okay. Well, I'm gonna clean up this mess, and then I'm gonna get started on studying, everyone. So thank you for watching. Like and subscribe and all of that fun stuff. Let me know that I'm not just doing this and talking to myself, and that I actually have people that are interested in it. But yeah, okay. Thank you guys. Let's say goodbye, Maya. Say goodbye. Yeah. You gonna say goodbye? No? You're just gonna look at me like that? And then Karma can come say goodbye too.